Hi, this is Nicole Lee. I want to give you guys out there some help if you have dry eyes, especially if it happens that you have blocked ducts. Like, for example, in the eyes, there's the tear ducts and the oil glands under the eyelids. They're actually the medical name for that is meibomian glands. The first thing you do to help yourself treat this condition, which is very unpleasant, it can create all kinds of side effects like irritation to the eyes, conjunctivitis, excess tearing, which is what I've had to live with for quite some time, especially in one eye. You'll know if you have it. Your optometrist will be the one to tell you. They don't always give you advice on how to treat it, though. But some doctors do treat these meibomian gland blocks through extractions. But I'm just going to give you an at-home treatment guideline on what you can do to start taking care of your dry eyes. What you would do is take a warm cloth, tolerate it as warm as you can, that when you close your eyes, you're going to put them on your eyes, each eye, for 1 minute or so to start off, but don't make it too hot a temperature. I like to use the microwave to get a wet towel. A small washcloth is what I use, and I like to put it in there. And if it's really hot when you take it out of the microwave, don't put it directly on your face yet. Shake it out. Take it by the hands and just shake it out. It'll air it out to cool off the temperature much quicker. So the warm compresses are to be applied to clear the debris which creates at the crust on the lid margin, and you'll do that. And then what I like to do is follow that up after a minute by massaging the eyelids, and do that for a couple of minutes. Do each eye. You might have to reheat the cloth because it will cool off really quickly, but I would do that every day or night after you get ready for bed. You can also use a stocking filled with uncooked dry rice and heat that in the microwave, and that'll last a lot longer. That way you won't have to jump up and keep reheating your wet towel. So that's one thing you can do to hold the heat in. It's also very soothing and comforting at any rate. So all this is going to make you feel better. Anyway, the eye massage for the meibomian gland dysfunction are blocked. They're blocked is what happens. We don't know why some people get them, but it could be from using makeup that you're allergic to. It could be all kinds of reasons for it. Be careful when you do use makeup about what you're using on your eyes, because they're sensitive and can develop irritations, especially with mascaras. Anything that comes in contact with the near the eye, like mascara, is especially troublesome for a lot of people if they don't change them out every couple of months. Or any of the eyeshadows that have a frosted look to them may have pieces of that metallic in there. There's some sort of metal that maybe you're allergic to or sensitive to. It's not at all uncommon to have sensitivities to that. So what I would do after that is gently close your eyelids, put one index finger on the outer corner of the eyelid, and then pull the eyelid towards your ear so the eyelids are stretched tautly. Then use the index finger of the other hand and apply direct pressure on the eyelid, starting at the inner aspect of the eyelid near the base of the nose. Sweep across toward the outer eyelid using the gentle pressure. Just repeat this maneuver about 4 to 5 times on each eye. The goal is to apply gentle pressure, not heavy pressure, for the eyelids. And then the third thing, lid scrubs This is a little harder to do, but you can get used to it because we tend to blink when we get too close to the eyeball itself with our fingers. So at the base of your lids are your eyelashes. And if you're going to use any kind of soap, be really careful and use something really mild, maybe like a baby shampoo on your fingertips. And do not get it in the eye. If you can avoid that, that would be better. But be careful about what you use so you don't use anything that's going to create conjunctivitis or eye inflammation requiring treatment from a doctor. Or you can dilute the eye shampoo, and use the scrubs. You scrub the margin of your eyelash bases with your eyes closed for 1 minute, following by a nice, fresh, warm cleansing or rinsing of that soap on your face and your eyes. Another way to do this is you could take a little cotton swab and try to get close to that area where I was talking about, close to the margin near your nose, and go across with a cotton swab. You know, just a little bit under the eyelashes and sweep it out. Another thing besides what we just talked about for the eyelid scrubs, they do have some commercially pre-prepared, pre-soaked pads. I think one of them is called Novartis, but you can ask the pharmacist if you would prefer to use something that is already pre-soaked and pay for it that way. You know that it's safe for you, but just tell them it's for lid scrubbing. After you complete the lid scrubbing, what I would suggest is either castor oil, or if you have neomycin or neosporin, that just put that on the eyelid where you scrubbed it, on the margin, not on the inside, but on the outside close to the base, where the eyelashes are, just to prevent from having any irritation. And that's pretty much it. And then the other thing I wanted to mention was if you are using eye cosmetic products that have kohl in it, be careful. It has not been approved by FDA as being something that's safe. A lot of people are allergic to it, and they're in a lot of eye pencils, eyebrow pencils as well, eyeliners. And so you have to be careful about that, because it has been known to cause allergic reactions due to some product that's in there that is a harmful agent. So just be careful about that. I would maybe even just eliminate using anything that says kohl eyeliner or kohl eye pencil, just to be on the safe side, because if it has nickel in it, that's not good either, because it can cause all kinds of problems to your eyes when you touch your eyes. It's another thing. Keep your hands clean. So that's all I have to say for you today, and I hope that if you have any questions, you ask and reply, and I'm here to pay it forward. Namaste.